make a start now. It's with great pleasure that I welcome you all to the Dent Culture and International Mental Health Conference. I would like to start with giving a bit of a background of how we started and what is behind starting this Culture and International Mental Health Conference. It is a collaboration which started initially with University of Manchester and University of Toronto. And then we have had a number of partners who have come on board from the UK, Pakistan, North America, and elsewhere. I was quite inspired by Lord Nigel Crisp. And Lord Nigel Crisp was the chief exec of NHS. And he came with this concept of turning the world upside down. And his point of view was that we can learn quite a lot from low and middle income countries. I originally come from Pakistan, born and brought up in Pakistan. And it's like all the other low and middle income countries. A large population lives under the poverty line. We've got very few psychiatrists, and the mental health needs are large. The burden is huge. And initially, people have tried a number of approaches with regard to health services, trying to adapt to the big burden and big need, and also focusing on health personnel task shifting. That is an example of a low and middle income countries. And then if we look at high income countries, it could be Australia, it could be North America, it could be Europe. And what we find is inequalities. There are inequalities within the majority population as well. But at the same time, Samin, would you help me with the slides? It's at the wrong slides. So can we go to the next one? Yeah. So then is the inequalities within high income countries. And particularly if we look at ethnic minorities, they are very much part of UK population. And according to the 2011 census, up to 14% of the population was from Black, Asian, minority ethnic groups in the UK, which is projected to be much higher in the 2021 census. And if we look at the disparities are quite high. So we see quite a lot of similarities in that way. And the work which we then started bringing a group together was looking at starting to initially understand what the needs are. And I'm just giving some examples here of the work of looking at the needs, looking at the social factors, and trying to understand why the disparities continue to exist. So this was based on the epidemiological work, and the epidemiological work led to developing interventions. And we call these culturally adapted interventions. In culturally adapted interventions, could we go to the next slide, Samin? In culturally adapted interventions, the science is really the same. So in this, if we look at the examples, what we have done is worked on depression to start with. So we did trials in Pakistan and looked at maternal depression, depression in general. And because the need is so high, we have been working across different disorders, taking a life course approach. We do have now enough evidence about there have been 2 to 3 systematic reviews carried out by our group, which clearly shows that culturally adapted interventions are more effective compared to the interventions which are not adapted. You're going to hear quite a lot the rest of the day about the different projects, different interventions which have been conducted. I think majority focus is going to be studies in the UK, studies in Pakistan, and some other work is going to be presented as well. One of the things which we have learned over the years is how much is the similarities in taking that approach. So using this example of which Professor Chaudhary is going to talk about is the culturally adapted intervention for suicide prevention. How it started from the UK and now is leading to large trials in Pakistan. Can we go to the next slide, Samin? And the other thing I wanted to share today is these are some of the news reports on the Mental Health Summit, which we conducted in Pakistan, hosted by the President of Pakistan. So in this, what I'm trying to give a message is that learning from one example, which is Pakistan and UK, there are no reasons that similar methodology cannot be followed up, starting from epidemiology, developing interventions, and taking it to the implementation and working with the policymakers. That is the message which is going to come across, I think, all through the different speakers who are going to present their work today. And one of the things I would want all of you to think about is how we can continue to develop on it. It's an annual meeting. We would like to have your suggestions of how do we continue to take this work forward. Next slide, Samin. So it's the important ship about is bringing people together, engagement from all sectors of the society. We talk about bringing stakeholders together, but we do not really go out, reach out to people from experts by experience, to the policymakers, to the third sector, and that is paramount if we really want to take this work forward. So I'm grateful to a number of partners who have come together during our journey. Next slide, Samin. We would like to dedicate this conference to our colleague, Kelly Dent. She had been an instrumental person with regard to organizing Culture and International Mental Health Conferences over the years, promoting the culture sensitivity and culture competence work. She sadly passed away recently, and we are always going to be missing her. So all the team wanted to dedicate this conference to Kelly Dent. I would now like to introduce our keynote speaker. It's with great pleasure and pride. Imran, I've known from medical school, very dear person. I can go on and on, talk about Imran, where we are standing today with millions of grants for global mental health, hundreds of papers and abstracts published, number of conferences. It would not have been possible without Imran's leadership in this group. He is currently chairman of Department of Psychiatry at Ziauddin University, Karachi. He's got visiting appointments, duly deserved at a number of universities. He's been a member of the NICE committees. He has had a number of awards from the Royal College, from the NHS, and since he is relocated to Pakistan, I think our work in the UK has also increased. His reach is now up to North America, and a number of projects with his mentorship are going on in Canada. I've just already taken 1 minute of his time, so I would now request Imran to come and start his talk. If you have any questions, please put it on the chat, and I can